There's been a lot of confusion about what's covered, what isn't covered under the Affordable Care Act, and today we're going to clear that up. I'm at Creekside Women's Center in Apex talking with nurse practitioner Erin Wright about the types of things, the important health things for women that are covered. And let's start with those annual visits that we all have to go through.
Yep, so under the new Healthcare Reform Act, annual exams are covered completely, and that includes quite a bit of additional screening that wasn't necessarily covered previously. So breast cancer screening, mammograms, bone density scans for women who are ages 65 and older. In addition to that, we can also screen for hypertension at the annual visit. And of course, at the annual visit, if you need it based on current guidelines, any Pap test and HPV testing is also covered.
What about screening for STDs? Is that part of that HPV and
Absolutely.
Pap test?
So STD screening can be done at the time of an annual exam. That's the most common time that it is done. You're there. It's a nice time to talk about your risk for those things. But under the new law, you can also make a separate appointment for STD screening, which is fantastic. So if you're concerned about your risk or your exposure, you can come in and that is covered under your insurance.
What about birth control? Are they all covered, or are there certain ones that we need to make sure we ask about?
So typically most birth control methods are covered now, and that includes counseling and screening for the right method for you, and IUDs are now almost always covered by your insurance.
If a woman is watching and she's not sure about whether something is covered, can she give the office a call and get some counseling on what to do?
Absolutely. We've handled so many phone calls recently with all the new changes. We are happy to call your insurance for you and verify the coverage that you may have.
Erin, what other services might people be surprised to learn are covered under the Affordable Care Act?
So now people can come in and actually have screening and counseling for depression, smoking cessation, as well as any routine scheduled immunizations that you may need, which importantly for our patient population would include the HPV vaccine, the meningococcal vaccine for high school and college-age kids, as well as the zoster vaccine for women ages 50 and older.
And what does that vaccine do?
So that is for the shingles, the herpes virus that can reactivate as shingles, which can be more common in older patients, and that is now covered as well.
Very good information. Thank you so much.
Thank you.
You can learn more on the web. The address, cwchealth.com.